purpose of this video is to describe the diagnoses of gender dysphoria and transvestic disorder and to make clear the differences between these diagnoses. Let's begin with the terms transgender and transvestism as they pertain significantly to these diagnoses. The term transgender refers to the continuum of individuals with a persistent incongruence between their experienced and expressed gender and their assigned or natal gender. For instance, a biological or natal male who identifies and lives as a female. It is important to note that this term represents a broad continuum of thoughts, feelings, and behaviors all connected by this incongruence. On the other hand, the term transvestism has nothing to do with one's gender. Rather, transvestism refers to individuals who dress as the opposite sex, also called cross-dressing. For example, a man who enjoys wearing traditionally female undergarments. Let's step into the question corner to tackle a common question regarding transvestism. True or false? Men who enjoy wearing women's clothing are homosexual. The answer is false. Not only is transvestism unrelated to gender identity, it is also unrelated to sexual orientation. In fact, a significant percentage of male crossdressers are heterosexual and married. Let's tackle another question, this one pertaining to transgender individuals. True or false? Biological or natal males who identify and live as females, or we call trans women, are always sexually attracted to males. Again, the answer is false. One's gender identity does not define their sexual orientation. Rather, there have been many instances of trans women who are exclusively attracted to women. So, now that it is clear how these two labels are different, it is also important to note that these are not mental disorders. Rather, they are important components of two mental disorders. Let's start with gender dysphoria. To be diagnosed with gender dysphoria, the incongruence previously discussed must be present, but the person must also be suffering from significant distress or impairment due to this incongruence. That being said, the majority of transgender individuals do experience clinically significant distress, depression, dysphoria, and/or impairment, warranting this diagnosis. Similarly, to be diagnosed with transvestic disorder, in addition to cross-dressing behaviors, urges, or fantasies, these behaviors, urges, or fantasies must cause clinically significant distress or impairment in functioning. Even further, the DSM-5 also requires that the individual experiences intense sexual arousal from cross-dressing.